Bansi and I are both therapists on the inpatient rehab unit at Oakville Trafalgar Memorial Hospital. I began working on the unit in 2019 and Bansi in 2021. In discussing what prompted us to apply for positions on rehab, while we came from acute care backgrounds, we found we were excited about similar things. These included collaborating within an interdisciplinary team, engaging in lifelong learning to be better therapists, as well as improving our skills to support client-centered goals and outcomes. We found great inspiration from the therapists already working on the unit. We will often talk about how we are in awe of the amazing work the OTs and PTs we get to work with do. One of the specific approaches we were introduced to was Neuro-Developmental Treatment, or NDT. Observing and learning from our colleagues, we knew this was something we wanted to pursue further training in. Therefore, at the first opportunity possible, we applied for the NDT certificate course and would like to thank the Brain Tumor Foundation of Canada for supporting our learning journey. NDT is an advanced hands-on therapy approach used by OTs, PTs, and SLPs with clients who have neurological movement and muscle control challenges. It uses principles of motor relearning and neuroplasticity to improve functional outcomes of the client, with the client and their family considered to be at the center of the approach. Through taking the certificate course, we gained a vast amount of knowledge and skills in observation and analysis of normal posture and functional movement, and how various impairments interfere with this. We learned handling skills to facilitate more normal postural control and movement of the body to accomplish functional tasks in relation to the client's goals. When we started the course, Bansi and I were OT and PT partners at work, and we carried the same client caseload. This gave us great opportunity to learn together and apply what we were learning with our clients right away. We were also able to support each other's learning through practicing our acquired skills with one another. A huge takeaway for us was the importance of collaboration between our roles and the large impact this had on all stakeholders involved in the client's recovery journey. When collaboration exists, we see the achievement of client-centered outcomes in an efficient, holistic manner. The entire team is on the same page and working toward common goals, supporting the client and family while working within the resources available. Without collaboration, we risk the approach to care becoming convoluted. It is difficult for the client to understand our proposed assessments and treatment interventions and how this pertains to their goals. It decreases the client's motivation and willingness to engage in therapy, which ultimately impacts their outcomes. We appear to work in silos rather than in harmony. While we learned the exact same material and had equal opportunity to apply the skills we were learning at the course, it is also important to recognize the unique aspects of our roles. As an OT, assessing and addressing cognition, perception, and vision through retraining or the provision of recommendations is vital. The information I gather and the strategies that I'm applying with the client are things I share with the physiotherapist and other team members that I'm working with. Many times, the client's goals are related to their physical well-being, but without everyone having a full understanding about what the client might be having difficulty with, beyond the physical impairments, it is challenging for the client to progress. Providing education is a huge part of my role.
Traditionally, when working in a hospital setting, physiotherapists are known to treat the lower extremities and work on the client's ambulation, while occupational therapists treat the upper extremity. The NDT training has helped us reinforce how integrating both the arm and leg in treatment sessions is essential to improve functional outcomes for the patient. NDT approach embraces collaboration between the different therapists and the family. This holistic approach allows for consistent use of facilitation strategies, which begins with addressing the physical deficits as well as having a good understanding of the client's cognitive, perceptual, and sensory issues, which aids in improved outcomes. While working with the clients with neurological impairments, we knew we wanted our interventions to be meaningful to the client and also reasonable given the restraints of the healthcare system. With knowledge of NDT, we have a better understanding of how the nervous system can be retaught with the right input. This has aided in knowledge translation to our client population, which has supported the client's understanding of the approach to treatment, ultimately contributing to willingness to engage in therapy, as well as improved functional outcomes. A number of our clients have had aha moments during our treatment sessions, and that's very inspiring to see. We have seen a powerful impact of our therapy sessions on our clients and their families. Keeping families and caregivers involved in a supportive role helps to further provide the client with opportunities to practice what they're learning. It also helps families feel as if they're an integral part of the recovery journey. Clients may also require less hands on assistance, decreasing the burden of care on families and caregivers. At times, this may mean the difference between a client being able to live at home with supports as opposed to needing transition to an alternative environment with increased costs. This is not always the case. Not only does rehabilitation process within a hospital setting such as ours have an impact on the client and family, it also continues to have an impact on the community at large. We already know there is limited resources available in the community, considering a larger number of Canada's growing aging population continues to live at home. Add a pandemic on top of that, and we're looking at a significant scarcity of resources. Decreasing the level of assistance of an individual and their needs has a ripple effect on ensuring their needs can be met in the community so they're able to live in their desired home environment and contribute meaningfully to the community. Our collaborative entity journey has equipped us with the knowledge and skills to support our clients with neurological impairments. This learning opportunity is something that has reignited our passion for the work we do on a daily basis. We come to work wanting to do the best we can for our clients. Our learning doesn't end here though. We are committed to being lifelong learners, striving to be better for the clients we serve. Ramjot and I would like to thank you all for listening to our presentation today, and we look forward to further opportunities to grow in our respective professions. Thank you.